practice schedules are basically just what is the skill and kind of how do you structure how you do that skill. The first one is called repetitive practice, and that just means you do a motion over and over and over again. And many of you know this because we talk about repetition all the time, but where it gets into a little bit of more of the nitty gritty is what type of a skill do you do that repetitive practice with? And there's two ways that we do this in physical therapy, and there's pluses and minuses to both, and this is what I see clinically as well, but they're just kind of highlighting it in this article, is there's mass practice and block practice. So mass practice is when you do an entire skill and you do it over and over and over again. So for example, you do a transfer. So you stand, transfer, sit, stand, transfer, sit, stand, transfer, sit. That would be like mass practice. Then there's something called block practice, where you break that skill down into its components and you work each one of its components separately. So maybe you do partial sit to stand, partial sit to stand, partial sit to stand 1,000,000 times or 50 times. And then you do standing, step, pivot, where you're just working on the standing component, and then you just work on the sitting component. That's called blocked practice. There's pluses and minuses to both depending on what stage in the recovery process you're at. So if you're in the earlier stages, that block practice is really good at acquiring a skill, meaning just working those components. But it's really good at performing the skill and initially acquiring the skill, but it's not really good at retaining that skill long term. And then there's mass practice, which is you do the entire skill together, transfer without breaking it down. And that's good, but that does impact performance, meaning that if you just put the entire skill together without breaking it down, you're going to see some degradation in someone's ability to perform that skill. Now, how do you know which one to do? If we try something 3 times and you fail 3 times, that's when you need to start breaking it down. A, you're just going to get frustrated, but B, you're not really learning anything anyway because you're making a lot of errors. So your performance is not great.